A very warm welcome to one and all. I'm Dr. Antony, emergency physician working at Krishna Institute of Medical Sciences at Karad, Maharashtra. Today, I would like to draw your attention to a simulation of a case of acute left ventricular failure management in the emergency department. Here, a 31-year-old male was rushed to the emergency department in an ambulance, after which he was taken to the trolley and rushed to the triage area. The triage nurse recorded his vitals, which showed a pulse of 126 per minute, a BP of 220 by 110 millimeters of mercury, a respiratory rate of 32 per minute, and a saturation of 80% on ambient air. From here, the triage nurse called up the ED team inside the Priority 1 resuscitation bay, and the patient was immediately shifted for resuscitation to the Priority 1 area.
Good evening. I'm Dr. Antony. I'm the consultant of the emergency department. May I know your name and your age, please?
Akash, age 31.
What brings you to the emergency department today?
I am not able to breathe.
The patient is conscious and coherent. The airway looks patent and there is no need for intubation right now. The patient's breathing is labored and I can see there's pink frothing from the mouth. Can we quickly auscultate the patient? There are massive bilateral crepitations in this patient. It seems like pulmonary edema. The triage nurse reported a saturation of 80% with a BP of 200 by 110. Devdas brother, I would like you to prop up the patient and start him on oxygen 50 liters on non-rebreathable mask. And also attach the cardiac monitors and recheck his BP too. Devdas brother, please keep the ventilator, NIV mask and the intubation set on standby in case we need to escalate the treatment. Dr. Jaskaran, take two 18-gauge cannula IV access and also collect blood for your investigations.
Okay, Dr. Mario.
Devdas, I also want you to expose this patient completely and put him on hospital gown.
Okay, Dr. Mario. Dr. Mario, I have proper patient. I started 15 liter O2 via non-rebreathing mask. I have attached the cardiac monitor and pulse oximeter. The pulse is 126 beats per minute. BP is 210 by 120 mm of Hg. Respiration is 32 minutes. And the SpO2 is 92 on 15 liter O2. The blood sugar level is 196. I also kept a ventilator and NIV mask and intubation set on standby.
Thank you, Brother Devdas.
Dr. Mario, I have secured two 18-gauge IV cannula in both the arms and I have taken the blood samples also.
Thank you, Dr. Jaskaran. This patient looks to be in pulmonary edema. Devdas brother, let's give him an injection morphine 2.5 mg IV stat along with an injection furosemide 60 mg IV stat. This would help the patient to get better and relieve him of his pulmonary edema. Brother Devdas, I would also like you to arrange a 12-lead ECG, a bedside X-ray, and I want you to arrange also an ultrasound machine to do a 2V echo and a bedside lung ultrasound.
Yes, Dr. Mario.
Thank you. Dr. Jaskaran, I want you to collect an ABG, send his lab investigations for serum creatinine, a complete blood count. I also want you to send a troponin I, D-dimers, and an anti-proBNP.
Okay, Dr. Mario.
Thank you.
Dr. Mario, I have given 60 mg furosemide and 5 mg morphine, but patient is more restless.
Akash, how are you feeling right now? Yes, the patient is very restless right now. Have you arranged the NIV?
Yes, Dr. Mario.
Okay. Right now, I think we should escalate our management since the patient has become very restless.
Okay, Dr. Mario.
Dr. Jaskaran, please switch on the ventilator and put on NIV mode. I want you to set an FiO2 of 100% and a PEEP of 5.
Okay, Dr. Mario. Sir, done.
Thank you, Dr. Jaskaran. Brother Devdas, I now want you to attach the NIV mask on the patient.
Okay, Dr. Mario. Dr. Mario, I have attached the NIV mask There are no leaks.
Thank you, Brother Devdas. Meanwhile, continue the patient on NIV and monitor his vital signs. In the meanwhile, I'll go outside and talk to the patient's attendant. Hello, I'm Dr. Mario Antony. I'm the consultant of the emergency medicine department. I'm taking care of Akash today. May I know your name and your relation with Mr. Akash?
My name is Anirudh Luthra and he is my brother.
Mr. Anirudh, is it okay if I can ask you some questions pertaining to Mr. Akash?
Yes, of course.
The first thing I want to ask you is he having any known allergies?
No.
Is he having any medications regularly?
Yeah, he has lot of medications, but I don't know the names.
That's alright. Is he having any past medical illness?
Yeah, he had a heart attack last year, but we went to the doctor also. Doctor told him some procedures, but he didn't undergo those procedures.
Alright, okay. When was his last meal?
Uh, Last night, 8 p.m.
Okay, okay. Can you exactly describe what happened today to him?
He woke up fine in the morning, but after 1 hour he started feeling breathless, so we got him admitted here.
Alright, alright. So this happened today morning, right?
Yes.
Okay, alright.
Doctor, is my brother okay, or is it a very serious condition?
Actually, on arrival, his saturation, which is the oxygen levels, were very low. Okay, so what we did initially was we put him on an oxygen, but he was not tolerating. We had to further increase the management. We had to put him on a ventilator on by mask, which we call as NIV. All right. After that, now we have sent his blood investigations. We have sent for his initial workup, and we are waiting for the results to arrive. Okay. In case the patient worsens or he's not tolerating the NIV, the ventilator I told, we might need to even intubate him, that is, pass a tube through his mouth and give him invasive ventilation. Okay. So right now I would say he's in a very critical condition. We need to admit him in the ICU, and definitely we'll be monitoring continuously the ICU after that. I've spoken to the relative, his brother. From what I can understand is he looks to be in pulmonary edema. Brother Devdas, have you arranged the 12-lead ECG and the X-ray?
Yes, I arranged.
Okay. I also want you to give the patient NTG infusion at 5 microgram per minute.
Okay, Dr. Mario.
Also, I would like you to arrange a bedside ultrasound so that I can perform a 2D echo and a bedside lung ultrasound.
Okay, I will arrange.
Dr. Jaskaran, have you arranged the labs?
Yes, sir.
Please show it to me.
Yes, sir. I will.
Dr. Mario, I have attached the entity drip at 5 miles per minute.
Thank you, Brother Devdas.
The point of care test which were carried out produced the following results. The ECG which was recorded showed all changes of anterior wall MI. The portable bedside X-ray which was taken showed signs of acute pulmonary edema. The bedside 2D echo which was conducted showed an enlarged left ventricle with signs of LV dysfunction. The bedside lung ultrasound showed multiple B lines as you can see. ABG reports, the CBC and the creatinine values were normal, but we had an elevated troponin I of 0.3 nanograms per ml, a D-dimer of 0.48 grams per liter, and an elevated NT-proBNP of 2100 picograms per ml.
I've reviewed the investigations, and this typically looks like an acute left ventricular failure as we early suspected. Brother Devdas, please can you reassess the vitals and tell me?
The vitals are the BP is 150/90, pulse rate is 100, and SpO2 is 99 on NIV.
Thank you, Brother Devdas. Akash, how are you feeling right now? Okay, good. The patient now seems to be improving on the NIV, so I want Brother Devdas you to continue the patient on the monitoring and the NTG infusion. Dr. Jaskaran, I would like you to catheterize the patient with Foley's catheter so that we can monitor the urine output.
Okay, doctor. Dr. Mario, I have a doubt.
Go on.
This patient has improved now, but in case he wouldn't have improved and he would have become more tachypneic, what would have been the line of management for us?
That's a good question, Dr. Jaskaran. So in that case, definitely we would have to escalate the management and we'll definitely plan for an endotracheal intubation.
Okay, sir. Thank you.
You're welcome. Dr. Taskaran, I want you to inform the cardiology team and also the cardiac ICU that we are shifting this young gentleman on an IV with a diagnosis of acute left ventricular failure. So please do that and let us mobilize the patient to the ICU.
Alright, sir. I'm on it.
Thank you, Dr. Taskaran.
Hope everyone who watched this simulation got some idea, if not all, about the management of acute left ventricular failure. I would like to take a minute to thank the management and administration of Krishna Institute of Medical Sciences, Karad. I also want to specially thank my head of the department, Dr. Suresh David, who gave me the opportunity to present on this platform of AEM Forum. This video would not have been possible if not for the efforts of Dr. Irshad Mohsen, consultant, Department of Emergency Medicine at Krishna Institute, and Dr. Kapil Bore, who had tireless nights shooting and editing the video. The other healthcare professionals associated with the videos were Dr. Jaskaran Singh, who was the junior resident, Brother Akash Tavte, who was the patient, Brother Devdas as the staff nurse, and Dr. Anirudh Luthra as the patient relative. So once again, I would thank one and all for being a part of this AEM forum, and thank you all.